If you're dealing with back pain, especially if it travels down the leg, causes numbness or tingling, or just isn't getting better, there's one key distinction you need to understand. Back pain and nerve pain are not the same. And if you treat nerve pain the same way you treat a muscle strain or joint ache, you're probably gonna stay stuck. I'm Dr. Chris Cameron, and in this video, I want to walk you through the difference between mechanical back pain and nerve-related pain. Why treating them the same leads to failed results, what research says about nerve healing, and what we do differently to help people actually get better. Let's dive in. Mechanical back pain is the most common type. It usually comes from muscles, joints, or discs, and it tends to stay local to the lower back. It often feels achy, stiff, sore, worse with movement, better with rest, triggered with poor posture, lifting, or inactivity, responds well to stretching, massage, and gentle exercise. This kind of pain is annoying, sometimes intense, but usually not dangerous. Nerve pain, on the other hand, that is a whole different experience. It often is described as sharp, shooting, burning, electric, traveling down one leg, classic sciatica, accompanied by numbness, tingling, or muscle weakness, worse with sitting, bending, coughing, or straining. This isn't just sore muscles, it's nerve irritation, often caused by disc bulge or herniation, pressing on a nerve root in the lower back. And here's what most people don't realize. If you stretch aggressively or push through nerve pain, like it's just a tight muscle, you can actually make it worse. That's why it matters so much to know the difference. We see it all the time in our clinic. Someone is dealing with nerve-related pain, but they've been treating it like a muscle pull. They've done stretching, massage, even core work, but the pain, it keeps coming back. Or worse, it gets aggravated. That's because nerve tissue is sensitive and it heals differently than muscles or joints. The longer a nerve stays compressed, inflamed, the more sensitive it becomes, and the longer it takes to heal. Getting the diagnosis right early makes a huge difference in how well and how quickly someone can recover. So, how do you know if it's nerve involved? In our clinic, we use a mix of hands-on testing, orthopedic exams, neurological screening, assess nerve function. That includes sensory testing, see if there's numbness or altered feeling, reflex testing, are your reflexes diminished, muscle strength testing, movement provocation test. Does the pain shoot when you do this? We're not guessing, we're measuring. And often the signs are clear before it even gets to imaging like an X-ray or an MRI. Healing a nerve is different from healing a muscle. Muscles have rich blood supply and heal quickly. Nerves don't. They take longer and they hate being compressed or inflamed. That's why the focus isn't just pain relief. It's removing the pressure, calming the inflammation, and giving the nerve a chance to actually recover. The three tools we use most often are spinal decompression. Gently relieves pressure from the disc and creates space around the nerve. It's non-invasive, comfortable, and highly effective when done properly. 2, deep tissue laser. It stimulates healing at the cellular level, improves circulation, reduces inflammation in and around the nerve root. 3, neuromuscular re-education, rehab. Often the nerve is healing, we have to rebuild coordination, strength, stability, so the problem doesn't come back. Let me give you an example. A patient named Laura. She came in with shooting pain down her right leg. She had tried yoga, stretching, massage, all the usual advice from friends and Google. But nothing helped. In fact, some of it made her symptoms even worse. We ran a series of nerve tests. We found reduced reflexes, weakness in her ankle, right ankle, clear signs of sciatica, nerve involvement, and disc issues. She started on a decompression, laser, and a customized rehab plan. After 6 weeks, not only was her pain reduced significantly, but her strength and confidence were back. And most importantly, she knew what to avoid so it didn't return. If you have pain that travels down one leg, feels sharp or electric, comes with numbness or weakness, don't treat it like regular back pain or muscle pain. You need a different approach, and you need to act before it becomes chronic. That's why we have created the Back Strong Evaluation. It's a thorough assessment designed to figure out, is the nerve involved, what's causing the pressure, and what is the best sequence to correct it. If you want answers, not just symptom relief, give us a call, 519-227-1363, and ask about the Back Strong Evaluation. The sooner we start, the better your chances are for full recovery.